Welcome to the Health Matters program produced by the Ministry of Health. I'm your host, Alicia Martin. Joining me on the program today is Ms. Gillian Trim, the Acting Director of the Food Policy Unit. Welcome to the program, Ms. Trim.
Thank you very much for having me once again.
So we've recently observed Caribbean Nutrition Day, and I know this is very important because the ministry has been pushing healthy eating and healthy lifestyle practices for such a long time. Now this day, tell us what this day means globally and what are the takeaway messages that we want persons to, remember and as well put into practice.
Okay, well, Caribbean Nutrition Day is commemorated on the 1st of June every year. So in the Caribbean, what we do is try to highlight awareness as it relates to nutrition, diet, healthy eating, and active living. And as the theme for this year says, healthy eating, active living, support policies that promote healthy food environments. And we know that when we look at chronic diseases or the non-communicable diseases, we see that there is an increase in the incidences and the prevalence. And that is because we have adopted a Western lifestyle when it comes to our diet.
Yes.
We are sitting more, we're in front of a computer, we're on our tablets. So we're not as active as our grandparents were. And because of that, we find that we're burning less calories, we're sitting more, and that is negatively impacting our health.
Definitely. And you spoke about activeness, and it made me remember daily exercise, the importance of it. Even though as we eat and we indulge in certain foods, it's important for us to maintain a balanced lifestyle.
That is
so
true.
I know that you guys have been doing quite a lot at the Food Policy Division. Tell us about some of the work that you guys have been doing there.
Well, at the Food Policy Division, we have 4 sub-programs.
Yes.
We look at breastfeeding, responsible for breastfeeding at a national level, nutrition education, anemia education, and we do a little bit of surveillance. And for breastfeeding, at the moment, we are training hospitals in the Baby Friendly Hospital Initiative. So we have a group of trainer monitors who have been trained, and we're going around to the hospitals, training them in the 10 steps to successful breastfeeding. So at the end of this training, we'll prepare the hospitals for them to be certified as baby friendly. And we know one of the main things as it relates to baby friendly is early initiation, because it's all about protecting, promoting, and supporting breastfeeding. And early initiation is where we ensure that the baby is put to the mother's chest or on her chest for 1 hour. So we call it skin to skin. And with that, the baby does the breast crawl. They attach themselves to the breast, and as long as we have early initiation happening within the first hour of birth, we find breastfeeding usually gets off to a good start. So we're working in that department with the Baby Friendly Hospital Initiative. We also have Breastfeeding Week that's fastly approaching. Breastfeeding Week is from August 1st to 7th, and we have lots planned for that week. We're going to be having our major celebration in Region 7, which is Bartica, along with some other symposiums we're going to have in Georgetown. And for anemia, we have some training that is planned for anemia with the health workers. So because we know the health workers, they have direct contact with the patients and with the community. So we're going to do another training in terms of anemia, letting them know what is anemia, how it affects the body, and how we can combat anemia with our diet. Because they're iron inhibitors and they're also iron enhancers. We want persons to eat their food with the iron enhancers and not the inhibitors, so that they will be able to absorb the iron, because iron is a major component in making blood or making their red hemoglobin.
Thank you so much, Ms. Trim. Quite a lot you guys have going on there.
Yes.
We're really looking forward to some of the work that you guys are going to do.
I would also like to mention that we're planning a training for growth monitoring, where we'll go around to all 10 regions and we retrain our health workers in how to plot and how to monitor the growth of our children from birth to about 5 years.
Yes.
Because with that, as long as we monitor their growth on a regular basis, we're able to see where there's faltering that's taking place, whether the child is losing weight, whether they're falling outside of the normal range in the chart, or whether they're going either over in terms of obesity or under, which should be in terms of undernourishment or underweight. So as long as we are able to do that, we'll be well able to monitor our children. And if you see any faltering, we can take corrective action. Plan an intervention program that we're able to ensure that our children grow healthily.
Definitely. And when we talk nutrition, we cannot leave out our elderly population. For those persons who are watching who might be caring for elderly persons, what can they do to ensure that their loved one has the best nutrition ever?
Right. Well, in the food policy, we look at nutrition throughout the life cycle.
Yes.
So we start from conception, and we have the first 1,000 days of life, which is from conception to 2 years. Then we also monitor our children up to 5. But we have a little, what we find is the primary school children and the adolescent health. We're not able to monitor them as we would like. But now we have the school health program that is up and running, and with that we're able to monitor them and to do some nutritional assessment. Then later on, when they're older, we try to do education programs, and even for our elderly, because we work with the senior citizens homes, and we work with them to ensure that they are eating healthily, because with our senior citizens, they may have problem chewing, they have to have a different diet, so we need to ensure that they are healthy and they get a proper balanced diet so that they can experience longevity.
Definitely. And even our elderly population and our children, I know persons are a little bit skeptical when it comes to eating a certain set of food, especially our fruits and vegetables. And I know that you guys have found really fun ways to still put those fruits and vegetables there and make it so attractive so that they can be able to consume it. Tell us a little bit about that.
Yes, that's true, because we have our recipes that we have put together in the food policy to make the consumption of fruits and vegetables easy. And for children, we always talk about color and texture and make the food nice, presentable for the children to eat. And then with children too, we want to allow them to eat themselves. They must be able to pick up the food and eat it themselves. They love to feed themselves. And for our vegetables, we have one of our recipes, or 2 of our recipes, use vegetables. We have our pumpkin drink and our callaloo drink. So we say to persons, if they don't want to eat their vegetables, you can drink their vegetables. And they make a lovely drink. And we can also mix it in cheese and put it in our cheese spread. And we can even mix it in our provision. When we're eating, we can mash, you can use our eggs. There are so many ways that we can prepare our vegetables and our fruits, especially for those that don't have a liking for vegetables. And when it comes to vegetables, we always encourage our mothers that whenever they're introducing complementary foods, because complementary foods are introduced at 6 months, we try to get them to introduce the vegetables at that stage. So the child now has an acquired taste for the vegetables. And 2, if you find the mothers eating a lot of vegetables, the taste of the vegetable goes across in the breast milk for the child. So the child gets the taste. So we encourage the mothers, eat a lot of vegetables, eat a lot of fruits, and introduce it at the complementary food stage, where they're able to, and then we tell them to introduce the vegetables even before the fruits, because the fruits are sweet, right? So introduce the vegetables because that may be a bit bland. So, and they can mix it and crush it with the egg, with the boiled egg. They can put it in the potato that is crushed, a sweet potato, mix it in, but ensure that the child gets the vegetables on a daily basis.
Definitely. Nutrition across the life cycle. Through your outreaches that you guys would have held so many different times, I've learned how you guys would make simple snacks like cassava ball and egg ball, and you do it in such a, a healthier way. Tell us about that.
That is true. We usually promote our callaloo drink and our pumpkin drink. And in terms of the egg balls, we do baked egg balls, because remember, we usually promote using less oils and fatty foods. So in order to fry, you have to add oil. So we tell persons, use a different method of food preparation. You can bake, you can boil, you can steam, or you can grill. And we usually prepare some of these snacks using those methods. Very tasty. And many times when we go to our outreaches and the patrons come, they'll love it. And we have the recipes right there to give it to them so that they can go home and practice in preparing these healthy meals.
Thank you so much, Ms. Trim. We're going to go into a break and be right back.
What does a healthy plate look like? It's made up of whole grains, healthy protein, vegetables, and fruits. Let's start with whole grains. Eat a variety of whole grains like whole wheat bread, whole grain pasta, and brown rice. Avoid those refined grains like white rice and white bread. Healthy protein. Choose fish, poultry, beans, and nuts, limiting red meat, cheese, and avoiding processed meats like bacon. Fruits and vegetables. Eat a variety of fruits and more green and other colored vegetables daily. They provide a variety of nutrients, antioxidants, and fiber, which build the immune system, prevent obesity, and promote healthy, youthful skin. Use more organic seasonings and less salty products like aji cubes and packet or bottled seasonings when preparing meals. And lastly, stay hydrated. Drink at least 8 cups or pints of water daily. Tea and natural fruit juices are great options. Avoid sugary foods and sweetened beverages. Eat well, keep moving. A message from the Ministry of Health Chronic Disease Unit. Exercise in your 40s seems trivial, but you need it now more than ever. The body starts to decline after 30, and that decline gets more aggressive every year. But exercise slows that decline, helping you prevent some common health conditions. To stay happy, healthy, and looking as great as you feel in your 40s, try these. To prevent heart disease, try cardiovascular workouts. It's a heart-pumping exercise that will keep your heart muscles strong. Ward off osteoporosis by adding a light jog into your walking workout to keep your bones strong. To fight arthritis, even in its tracks, strength training has been proven to decrease joint pains. Women between ages 45 and 64 have an increased risk of depression, and yoga reduces stress and regulates mood. Back pain becomes common as we get older, so try holding a basic plank for 90 seconds. Life's a little sweeter over 40. Eat well, keep moving. A message from the Chronic Disease Unit of the Ministry of Health.
Welcome back. For those persons who've just joined the program, today we're talking about healthy eating, active living. And with me, I have Miss Gillian Trim from the Food Policy Division. Miss Trim, we want to talk a little bit about the food-based dietary guidelines for Guyana. I know this was relaunched in 2017, and we would have talked about it before, but today I want us to go in depth and talk about each one. Let's start with number 1.
Okay, well, before we get into our guidelines, I would like to discuss the theme, healthy eating, active living, support policies that promote healthy food environments. And this is our national food-based dietary guidelines. And these guidelines were first launched in 2002, and there were 7 guidelines. But then over the years, we realized it was a bit deficient because breastfeeding was not included, and then the fruits and vegetables were lumped into one guideline. So we separated it out to ensure that each is focused upon. So in 2017, the Ministry of Health, along with the Food and Agriculture Organization, revisited and relaunched the food-based dietary guidelines. So we now have 9 guidelines. And also physical activity is incorporated in the 9 guidelines. And these guidelines were prepared in layman's terms, using scientific terms and also food composition tables, and we were able to prepare it in layman's terms. Everybody can understand. And they were created with several objectives. 1, to promote healthy choice with respect to variety, quality, and quantity. 2, to prevent overweight and obesity and to reduce the occurrence of non-communicable diseases. And we spoke earlier about these non-communicable diseases, which are the chronic diseases. We have hypertension, diabetes, heart disease, and the list goes on. And the third objective would be to prepare and promote physical activity, because we know that is also incorporated, to prevent the development of nutritional diseases, and to store and prepare food in a clean and safe manner. And we want to ensure that persons know these guidelines, abide by these guidelines. Keep it close in your kitchen when you prepare your food, so you know exactly what are the 6 food groups and how we need to put together a healthy, balanced diet. And the first guideline says breastfeed exclusively for the first 6 months of life. I know we've been talking a lot about... This is
really the beginning of everything.
Exactly, because breast milk is the first food.
Yes.
Right? So we have to start with breastfeeding. And we know that breast milk contains all of the nutrients that the baby needs for the first 6 months of life. You don't need to give baby anything else. No water, tea. Only if the doctor maybe recommends some medication or so, yes, fine. But other than that, all the child needs is the breast milk. And the breast milk has water, because some persons say, we are 80% water, so we need to get water. But the breast milk provides all of the water that the child needs. But after 6 months, we want to encourage mothers to introduce complementary feeding. Because at 6 months, the breast milk would not provide the kind of energy and nutrients that the baby needs, because baby is growing and baby is active and moving around. So we have to fill that nutrient gap with the complementary foods, which are foods from the family pot. So the child can eat the foods from the family pot, whether it's rice, whether it's fish, whether it's our peas and beans. But we need to ensure that it's prepared in a manner so that the child can eat.
Yes.
And if you look at guideline number 2, which says eat different types of food from all of the 6 food groups. And we know we spoke about that earlier, because each food has been grouped into, they've been grouped into the groups of nutrients that they're a good source of.
Yeah.
So you find foods that are a good source of carbohydrates, they're grouped into one group. Foods that are a good source of protein, they're in another group. So we have the 6 food groups. We have our staples, which we get our carbohydrates. We have our food from animals, and that's the protein group. We have our legumes, which is another protein group. We have our vegetables, and we get our minerals from the vegetables. Mostly we get our minerals, and we get some vitamins too from our vegetables. We have our fruits, where we mainly get our vitamins, right? All of the various vitamins, we find them in fruits. And then we have our fats and oils, right? People are saying, you know, we don't want to consume fat, but we need fat, but in moderation. We don't want to be utilizing too much fat, because our body needs fat to protect our organs, and also their fat-soluble vitamins that are carried in fat. So we need to have fat as part of our diet. And we need to tell persons, in terms of the 6 food groups, when preparing our meals, look at color, look at texture. When we go to the market, one of the things I love, when we go to the market, there are a wide variety of fruits. And we tell persons, don't go for the expensive ones. Go for the fruits that are in season. And we find them in abundance. And so much color, so much texture, so much flavor. Let us put them together on our plate for ourselves, our families, and especially our children.
Yes.
And guideline number 3 says, eat more green and other colored vegetables daily. And that's another thing with our market. When you walk into our market, so many vegetables, a wide variety of vegetables. And we know that for a balanced diet, half of our plate is supposed to be fruits and vegetables. Just quarter is supposed to be the staples or the rice. And then we have the legumes or the protein at the fourth quarter of the plate. So as long as we eat like that, we are going to ensure that we meet the objectives of the food-based dietary guideline in terms of preventing overweight and obesity, and also nutritional deficiencies. And if we look at guideline number 4, which says eat different kinds of fruits daily. So it's all of the food groups, vegetables, and fruits, even though we pull them out again because they're extremely important for the diet. So we need to ensure that we utilize a lot of fruits. And like I said, look for a variety. Look for the brightly colored fruits. Right? Those are the ones that have the antioxidants, the vitamin A, and all the vitamins that we need, the B vitamins. They all are found in our fruit.
We too can encourage parents to, you know, pack fruits in lunch bags.
That is true.
As the kids go to school, and even for the working class, when it's snack time, you have a fruit.
Exactly. We have your fruits, you can dice it, you can slice it, you can prepare it however you want. But instead of these packet foods, and we're going to talk later on about these salty packet foods, and I know it's easy to acquire. We just go and we pay how much ever we pay, and we get the packet and we put that in the children's lunch kit, or we give it to them to keep them quiet or to keep them away from us. But give them fruits, right? Let them, you can prepare it in nice little small dice size.
Make it attractive.
Exactly. You let the child eat it themselves. Give them with a fork, or even let them pick it up with their fingers and they use. So a wide variety of fruits is extremely important. And guideline number 5 says, limit the use of sugary foods and sweetened drinks. And the thing about sugar is that we call it empty calories. It doesn't have anything else but just calories. And so you find a person who likes to use a lot of sweet or loves sweet, would find themselves, if they use it a lot, will find themselves gaining. So for the sweet drinks that we drink, if you check, read the labels, check, and you will see sometimes one drink has the daily required amount of sugar that is needed. So if you take 2, that means that you're overdosing with the sugar, if I can use that word. So read labels and ensure even when you make your homemade drinks, you don't add sugar. There's sweet fruits that we can use in our smoothies. You have the banana, you have the pineapple. They're very sweet pines out there. You have apples. So that you can mix the sweet fruits with the sour fruits, and you can have a nice shake or a nice smoothie. And try to avoid adding sugar. Try to avoid the sweet drinks and the aerated drinks and the bottled beverages. And if you look at guideline number 6, it says use more natural seasonings and less salt and salty products, as we mentioned before. Those packaging, the corn curls and the cheese sticks and the potato chips, if you check them, there's lots of salt in those packets, because what happens with processing, we lose the nutrients. As the food goes through the process, we lose nutrients. And as long as nutrients go, flavor goes. So what is done now, salt is packed, because we know salt adds flavor. So salt is packed, or sugar is added, or sometimes even fat is added, because we know fat too adds flavor. Fat tastes good. So we have to be very careful with those when these things have to be added. That's because now the food is devoid of nutrients. And many times we eat these things and they just fill us up. We call them fillers. And I referred earlier to the Western diet that we're adopting. So these are the packaged stuff that come in, what the supermarket sells, right? All of these are processed foods. We try to get persons to avoid all these meats, these luncheon meats and so on, are packed with salt to preserve for shelf life, and even the saturated fat also preserves shelf life. And it makes the food taste good. But it's just about taste. We have to look in terms of nutrients. Are we getting the required nutrients for our bodies to work optimally?
I know many persons might think at times, oh, it's just a light snack. But then we really do have to check the nutritional benefits and how it's actually benefiting the body and our daily health.
That is true. And then remember too, there's certain vegetables that have salt. There's a recommended amount that we're supposed to take during the day. So when we use in our food that we prepare, we will have the salt. But when we add these snacks, these salty snacks, we are taking too much salt into our bodies, and we want to reduce our intake of salt. And we want to encourage to use natural seasonings to flavor your pot. We have our garlic, our onion, our turmeric, our celery, our thyme, all of these natural seasonings we have. And for our sweet beverages, we have our cinnamon, our clove, and our nutmeg. Let us use these natural seasonings to flavor our pot. Because what you find happens too is that the salt that we use too much salt, it masks the taste of these things. But the moment you reduce the salt or eliminate the salt completely, and you use the natural herbs and spices, we find we have no acquired taste. And we taste what the shallot tastes like. We taste what the celery tastes like. And it enhances the flavor of our food.
Indeed.
So we encourage persons, use our natural seasoning. We have our ginger. We have so much on the market. Peppers, whatever we want to do. Let's use that to flavor our pots. And if we look at guideline number 7, which says reduce the intake of oily and fatty foods. And I alluded to this earlier, right? In order to fry, we have to add oil. So we encourage persons to use a different food preparation method, bake. So instead of frying our egg, we can boil it. Instead of frying our fish, we can steam it. And instead of frying our chicken, we can bake it. All right, so these alternatives help us to consume less oily and fatty foods. And guideline number 8 says, if you drink alcohol, do so in moderation. And this word moderation, it's debatable, right? Because what I would consider to be moderate, somebody else may not. So with this, because this guideline, when we were looking at it, had a lot of discussion surrounding it. We spent most of the time on this guideline. So we had to come up with some standards, right? So we agreed that, listen, 1 drink per day and no more than 3 per week. So if you want to have a beer, we say 1 beer per day, 1 shot, or 1 glass of wine, whichever is your beverage of choice. And a lot of people frown on this because, you know, when people go out at their social activities, they compete to see how many persons can drink the most beers or drink the most shots. But we are not treating our body healthily if we do that. We need to think of our longevity, we need to think of our health, and we need to think of what we're actually doing to our bodies. And alcohol always has a negative effect on our body in terms of our health. And then we have the other part of it, where you have the domestic violence, you have the road accidents, which is another component of the alcohol consumption. So we say consume alcohol in moderation, 1 drink per day. And if you can do, that's if you have to drink. But if you don't need to, we say avoid it at all costs. We have our homemade beverages that we can use to replace.
Then too, with alcohol, we must remember that we must be balanced in our nutrition. So having more of it might kind of hinder our nutritional lifestyle.
Yes, it affects our bodies negatively. It affects our organs negatively. And studies have shown too that there are over 200 chronic diseases that are linked to alcoholism, and you can go and check. You can check the research. The evidence is there, right? So some of these diseases I know are rare. We don't see them in this part of the world, but over 200 of these diseases are linked to alcoholism. And if we look at the last guideline, which is guideline number 9, it says use at least 30 minutes daily for physical activity. And we spoke about the balance, healthy eating, active living. So we need to get up from our beds, get up from our couches, get up from our office chairs and do some physical activity outdoors. It's better we go out in the fresh air, we get the sunlight, we inhale the fresh air, and that does our bodies well. And then too, with exercising, we say at least 30 minutes. You can do it early in the morning or you can do it late in the afternoon, whichever you prefer. I prefer early in the morning before we have all of these vehicles and the carbon monoxide and all these fumes that are in the air. So we say 30 minutes. It could either be brisk walking, it could be skipping, but I won't recommend skipping for everyone. But everybody can do brisk walking. You can go up and down your stairs. But do some form of activity that increases your heart rate, that helps you to sweat. Because we know with sweating, you get rid a lot of toxins comes out in our sweat. And then with that now, we would drink more water, ensure that we use our 8-ounce glasses of water, which helps to flush and to clean us out. Right, and then even with the fruits and vegetables, it helps us to in terms of digestion and our food moving along, our colon and our elimination process.
Definitely. Thank you so much, Ms. Trim. Very informative. What would be your advice to the listening and viewing audience with regards to maintaining a healthy lifestyle and ensuring that, you know, they take the necessary nutritional health tips that you would have shared today?
Yes. And it's important to maintain a healthy body weight. And one of the things we do when we go to our outreach activities and so on, we do nutritional assessment in the form of the body mass index. And that tells us, gives us a number, and it tells us whether you're underweight, you're a healthy weight, you're overweight, you're obese or extremely obese. But we tell persons, we advise persons if we notice that they're overweight or they're obese, try to get back to a healthy weight. Look at your portion sizes. Look at what you're eating. Increase your level of physical activity and exercise to get back to a healthy body weight. Because studies have also shown that these chronic diseases that we spoke of are directly linked to obesity and to being extremely obese. So we tell persons, ensure watch what you eat. Read food labels. Do not utilize a lot of sugar. And ensure that our portion sizes, we eat just enough. We don't eat to feel stuffed. Eat just enough to give your body the amount of calories that it needs to work optimally. Maintain a healthy body weight. It's best for all of us.
Thank you so much, Ms. Trim. I want to encourage you to keep up the good work that you guys have been doing at the Food Policy Unit.
Thank you very much.
This was the Health Matters program. Thank you for staying tuned with us. I'm Alicia Martin, saying goodbye for now.